So something I want to talk about is osteoarthritis of the hands. A lot of times patients will tell me there's absolutely nothing they can do about all these nodules that are forming in their hands, their lack of mobility, but that's just not true. There are specific exercises you can do to increase mobility, but also you can get treatment on the area. So let me explain here. You can actually get into certain areas. When we think of the process of osteoarthritis, we actually get decrease in fluid exchange, joint capsules start to get walled off, and inflammation ensues, and it actually starts to expand. If we get on the joint and actually mobilize the joint, we'll find we'll get better fluid exchange, and we'll find that people start to get their mobility back. You cannot turn back the clock. Otherwise, I'd have people lined up around the street. On the same hand, you can get treatment, let's say, once a month or so. Get in, work on those joints, and you're going to see an increase in function. So what I'm talking about here is, for example, on the wrist, just getting in and working around the joints here. How are we doing there, Vicki?
Good.
Well, things are moving there.
Yeah.
A little tight. But we also realize that when it comes to the wrist, for example, that all of the muscles in the forearms, in the flexors and the extensors, they can get tight and contracted. So if we get in those and we take pressure off those structures, that takes pressure off the wrists. And the same thing will be true with the hands. Doing okay there?
Oh yeah.
No problem?
None.
All right. So let's just get on the extensors here a little bit. Yeah, you're definitely tight there.
Yeah.
Wow.
The life of an RMT.
There you go. Okay. So we'll actually get in and we'll free up some of the soft tissue. And then afterwards I'm going to get into the joints. So as I was saying, the flexors come up here, the tendons go underneath the wrist, but then it also connects into the fascia of the hand. So we need to get in and kind of work that out a bit too. Doing okay there?
Yeah, that's good. You don't do these movements on your own, so
No,
this
there's
is
no way
nice.
you can. But the combination of getting therapy and exercise is critical. You can keep the mobility in your hands throughout your life, and you won't get that those expansive joints taking place to the same degree you would otherwise. Yeah, a little cavitation there.
Yep.
Good. So it's going to work down here a little bit. There we go. You okay?
Oh yeah.
Good. So as you work around the joints of the hand, you want to make sure that we go through each of the joints and really get in there and mobilize it and kind of traction it out so you get a nice expansion of the joint. You okay there?
Yeah.
So just get on there. And if I find a real restriction with the patient in their hands, I may actually work for 30 seconds to a minute on just one joint until I felt that release, let go. Because if you just get in there and kind of move it around a little bit, it's not going to change. You need to get in there and work it out. Good. This can make a huge difference in your function. For a lot of people, they find they can't close their hands very well. And almost immediately after working on them, they have increased range of motion. They're no longer dropping things. They're able to pick things up. They're able to close their hands. They've got their strength back. And the main thing that they're really amazed about is that they waited so long to get therapy, because they actually could have had a lot more function. They just got a little bit of maintenance care once in a while. Doing okay there?
Uh-huh.
Good. And up. And of course, I'm only working on one side right now, but we do both hands. Even if one hand is the one that's bothering you, the other one's not bothering you at all, this is all about prevention. And then the wrist. There we go. How's that feeling?
That's good.
Really opens it up, doesn't it?
Holy cow, yeah.
And this group of muscles here, the thenar, if I just get in there, kind of open that up a bit. Especially you working with your hands.
Yeah.
There we go. Good. There we go.
Yeah.
That opened up. So, I just want you to realize there is a lot you can do about osteoarthritic changes. whether it's in your hands, your shoulders, your knees, your hips, wherever it is, you can get maintenance care for this, and we can prescribe specific exercises to get you back and more functional. So, if you're hurting, come and see us.